Well, when it comes to our health, some issues are not a big deal to talk about, but other issues we might get a little bit embarrassed about.
Being embarrassed doesn't mean you have to go without help. When it comes to pelvic floor disorders, our next guest wants to talk openly so more people feel more at ease.
That's right. Dr. Josh Woelk is a urogynecologist and comes to us from Methodist Physicians Clinic. Thanks for coming in,
Nice
Doctor.
to have you here.
Nice to be here.
First question.
Yes.
The obvious question. What is a urogynecologist?
Yes. So a urogynecologist is generally either a gynecologist or a urologist that's gone through some extra training, done a fellowship in female pelvic medicine and reconstructive surgery that deals with these pelvic floor disorders. So most often it's usually an OBGYN that's gone on to do some extra training. There are also some urologists out there that do it.
What about the specific problems you treat? You kind of touched on it there.
Yep. Specific problems, incontinence of the bladder, stress incontinence, urge incontinence. They're kind of two different sides of the same coin. Also pelvic organ prolapse, which is a problem where things like the bladder and the rectum can actually bulge out of the pelvic floor through the vaginal opening. And, you know, they're all very bothersome problems. They're not dangerous, luckily enough, but they are very, very embarrassing, and they keep a lot of women inside. They don't want to go out for fear of having an accident. You know, they don't want to exercise because it's uncomfortable. And
So it's really a quality of life
It is,
issue.
absolutely.
Yeah, and I guess one of the questions I have, does this affect women of all ages, or is it maybe more the senior women?
Yeah, that's a good question. They do affect women of all ages. Kind of depends on what they do. There are young gymnasts that can have incontinence problems. I'd say the main portion of our patient base is post-childbearing years women. You know, that's the biggest risk factor is childbirth.
What are the signs, the symptoms that you should probably see a doctor?
Well, basically, it's not dangerous, which is a good thing. But basically, if it's bothering you, affecting your going out of the house, socializing, exercising, being active, that's pretty much when it's time to see a doctor and do something about it, because it's always good to stay active, it's good to stay social, and that's one of the big bad things about incontinence and pelvic floor disorders, is that it
You don't want to
keeps
go
people
out
from doing that.
You never know if you could have an embarrassing moment, which brings us to the topic of embarrassment. Is it embarrassing for some of the women to come in and talk to you about?
It is very much so. A lot of women have been referred, some just come in because they've heard about these sorts of things. But it is kind of hard for them to talk about, you know, but you know, it's bread and butter stuff that we do in the office every day, so it's not embarrassing to us.
Well, and there's treatment options available.
Yes.
So what can you do?
There's both non-surgical and surgical options for these things. With incontinence, there are pelvic floor physical therapy, believe it or not, helps out a lot. There also are surgeries and medications, dietary modification for incontinence. For pelvic organ prolapse, there's non-surgical ways with holding the prolapse up that we do in the office. There's also surgical options, both vaginal and abdominal ways of doing it.
Yeah, so there's things that can be done to treat these conditions.
Absolutely.
And I guess part of what you need to do is to get in and talk to a doctor, start talking about it. So,
Yes.
And you're talking publicly about it. You have no problem doing that. So there's some events coming up that can help that discussion get started by someone.
Yeah, exactly. We've got a couple things coming up in September. I'm going to be talking at the, well, actually, we've got a booth set up at the Ovarian Cancer Walk with the Gynecologic Oncologist. We're going to be there to answer questions. And then we also have, I'm going to be speaking at the Go Red for Women event that's at the Embassy Suites in La Vista.
It's a great event.
Yeah, it's a great forum, you know, about 10-minute talks with women. There's, you know, of all ages of doing, you know, all
So
sorts of
you'll be
women
doing those
health.
sessions prior to the dinner and all of that starting? I know they have the breakout sessions.
Yes, and that's what it is. I'm going to be in one of the breakout sessions.
Wonderful.
And then we also have an event at Bricks with Wine and Cheese that my partners and I are going to be going over all these different pelvic floor disorders in more detail. And it's also kind of an informal forum, so you know, it doesn't have to be as embarrassing.
Well, for women who are hesitant to make an appointment and it's sort of just go and sit in the back of the room and get the information, that way you're taking care of yourself.
Absolutely.
I'm sorry, no, go ahead.
Oh, I was going to say, you don't need a referral to come in. If it's just something that you hear us talking about and you're concerned, then people can make an appointment.
Yeah, and you know, I was asking you before the segment started, guys, you know, a lot of guys come into your office with their spouse or their significant other to discuss these issues as well, just for support, I guess.
Yeah.
Absolutely. Yeah, and I always encourage patients to bring in their significant others, especially if they're contemplating something like surgery. It's always better to have, you know, two sets of ears hearing everything and two people asking questions, because it's, you know, it's an embarrassing thing, and the treatments can be pretty involved a lot of times.
Well, and that's interesting that you say, because we might miss key details, and then you get back to the house, and then the one person says, "Well, didn't you hear him say?" And you go, "Wait a minute, okay, I get it."
Take a pad and a pen too.
Yeah, you know, a couple of times we've shown your website. What will our viewers find there? It's mpcurogynecologist.com, but it really talks about kind of taking back control, living life instead of letting all of this get in the way.
Yeah, and that's exactly the idea. The whole problem with pelvic floor disorders is that they decrease quality of life, and people nowadays don't need to be held back by that. I think a certain more mature generation of women have been taught that this is normal aging, something you don't talk about. It's just part of having babies and getting older. Well, it may be normal, but you don't have to live like that. And you can get out and get back to having fun.
Yeah, there are things that can be done. There's treatment options available.
And where can our viewers find you out west? I know.
It's at the, we're at the Women's Hospital at the Methodist Women's Center at 192nd and Dodge. So
They have it, and the number, it's 402-815-8942. Again, mpcurogynecologist.com. Dr. Woelk, it's nice to have you here.
Yeah, it's been great
Thank
being
you
here.
very much,
Nice
and all the
having
best heading into a busy September and
oh yes,
November
A
for
lot
you
of
here.
events.
Thank you.
that's right.
So our guests, they bring us news of special events like Dr. Woelk, sometimes special savings exclusively for Morning Blend viewers. So if you ever miss a live show, we encourage you to keep in touch by watching clips at omahamorningblend.com. So we're excited.